Welcome to the Voices for Voices podcast, sponsored by Redwood Living. Thank you for joining us today. I am Justin Allen Hayes, founder and executive director of Voices for Voices, host and humanitarian. You can learn more about Voices for Voices on our Instagram, Facebook, and YouTube channel at Voices for Voices, and also on our website at voicesforvoices.org. Voices for Voices is a 501c3 nonprofit charity organization that survives solely on donations. So if you're able to, please consider heading over to voicesforvoices.org to help us continue our mission and the goal and dream of mine to help 3 billion people over the course of my lifetime and beyond. Or you can also send a donation to the mailing address of Voices for Voices at 2388 Beckett Circle, Stow, Ohio 44224. Or we're also on the Cash App at Voices for Voices. Are you or somebody you know looking for a volunteer opportunity? If so, you can reach out to us today via email at president@voicesforvoices.org. Now, I founded Voices for Voices to provide a platform for folks to share their stories with others as we work to break the stigma around mental health, accessibility, and disabilities, while also helping them get the help they need and also working with them to prepare or transition into the workforce with the Voices for Voices Career Center, where we connect talent with opportunity for both job seekers and employers alike, from coast to coast and in every industry and job level. And who can forget about merchandise? The Voices for Voices merchandise shop is finally up and running at voicesforvoices.org/shop, where shipping is always free. And again, all donations are 100% tax deductible. So we're pleased and excited to introduce today's guest. He is a Central Catholic alumni like myself, and also a Walsh University alumni. And he is a family medicine physician at Community Healthcare in Louisville, Ohio. And he's also the CEO at Community Healthcare, Inc. So why don't you please join me in welcoming to the show Dr. Brady Steineck. Thank you for joining us.
Thanks for having me, Justin. Appreciate
Absolutely. Yeah, it's good to catch up and see you in person, seeing a lot of great professional developments, and just excited for what you have coming up and what you've done. For our audience, if you maybe talk a little bit about the career of medicine, how that piqued your interest and got you started, the schooling, and what that's like for any individuals that might be interested in medicine.
Yeah, so, well, thank you. It's really great being here with you. I don't know if the audience knows this. We knew each other since we were about 13 or 14 years old, playing baseball together growing up. And so it's very nice to be back with you. Being a physician is challenging, but I love it, and it's something that is a huge calling on my life. It's not just a job. It's kind of a vocation. It's who I am. It's part of our identity. And I think if you ask most doctors, that's how they feel. And for me, growing up, I always had a lot of great doctors in my life, my pediatrician and others that I looked up to. And when I got into high school and beyond, I really liked life sciences and just the idea of helping people. And so, as you know, we played baseball together. So, every kid thinks they're going to be a professional baseball player, right, or something like that. And when I realized that I'm 5'6" and that wasn't going to happen, we had to go with Plan B. So in college, I ended up really liking biology, chemistry, physics, and ended up doing a pre-med course at Akron-U. And in that way, ended up taking the med school admission test. And then the way medical school works for most programs is that after you graduate from an undergraduate degree, medical school is usually 4 years. And so I went to NeoMed, is what it's called now, Northeast Ohio Medical University. It's over in Rootstown, Ohio. So I went there for 4 years and did general medical training, graduated in 2008. And then physicians are not done at that point. At that point then, as a doctor, you have to do what's called a residency, which is training on the job.
Okay.
And it is into your specialty. And so for me, I went into family medicine because I liked everything. As a family doc, I get to see patients of all ages, birth to death. And so I love that. What I loved about it is relationship building and being able to know my patients over the long term. And I love where I practice. Louisville is just east of Canton, where I grew up. And so a lot of my patients are family, friends, relatives, people that I've known my whole life, or people that friends of family members. And so, and I love as well being a little bit into a rural area because just really love kind of that down home vibe of kind of knowing everybody in the town, everybody knowing me, having multiple generations of patients that we take care of, and which is really fun. Just today I visited a patient who is we have 4 generations of their family that come to my office for care. And so, and it's crazy, it's different stages of life. We were having a visit with her, she's 92, talking about end of life planning for her. And we have her great grandson who's a few months old. So I love that part of it. And so being a doc for me and going into medicine has been just an amazing journey. And being able to look yourself in the mirror and say, hey, my job is actually trying to help people. It does a lot for your own mental health as well. And so yeah, that's my journey, kind of being a doctor, how I came through. And that's just the start, like you said. A lot of other things going on as well.
Yeah, and so when somebody thinks of a family physician, they might have a certain picture in their mind, but what you do is much more than that. Besides being there for all the life events from multi-generations, but not just seeing somebody at their annual physical. You and your organization that you lead and you run does more than that. Can you maybe talk about some of that expansion, how that maybe came about?
Yeah, so I was blessed in my residency to start to meet some physicians that worked for a company called Community Healthcare. Several of them ended up being teachers, instructors, and mentors to me. And then I was introduced through them to the founder and then CEO of the company, Dr. Rodney Eisen, who became an amazing influence on my life and is to this day. And community healthcare is, when you think of what medicine traditionally should be, how it was formed and what Dr. Eisen did is truly the soul of what that is. Dr. Eisen was the first person in his family to go to college, as I am. He grew up really in a very rural, poor, dirt floor type farm in Kentucky, and ended up in Ohio in school, went to medical school, and ended up training at Barberton, and ended up opening a practice after his training in the mid-'80s in Canal Fulton, Ohio. And that's how community healthcare began, with one guy in one office.
Wow.
And through the years and through the 80s and 90s, community healthcare grew as his mission kind of spread, which was the words in the name of the company are true, community. And like you kind of mentioned in your question, his goal and our mission isn't that we're just treating the patient in front of us. It's that we really are trying to care for the entire community where our office is. And so Canal Fulton has done that. It's grown to the point now we have 17 locations in 4 counties. And just an amazing growth and amazing story. And honestly, I think we're just getting started. A few years ago, 2013, 2014, I was at his house. My kids were jumping in his pool, and he kind of drops this bomb on me where he says, hey, what do you think about succeeding me as the CEO?
Oh my gosh.
So after I picked up my jaw off the floor, I said, well, what does that mean? He said, well, he's had 30 years of experience to do that job where I didn't. And so he's like, you're going to need extra training. So as you mentioned, I went to Walsh. I started in all my free time.
Of course.
Went to Walsh on nights and weekends to get a business degree. To learn, in medical school, all you learn is how to treat a patient. You don't learn how to do the other parts. And so I went to business school and after that and I did also some leadership training. You know, just because you're good at taking care of patients doesn't mean you're a good leader. Yeah. And I'm still working on leadership and management. You can never be good enough. You have to always improve. But I went through leadership training through a company called Giant Worldwide. And so I did some intensive work on myself to get to the point where I felt like I was at least had the tools to help me succeed in that job. And so then God's timing is pretty funny because right in the beginning of 2020, I was approved by the Board of Community Healthcare to become the CEO. And of course, nothing happened after that that was stressful or stressed our system or was, you know, as an independent company was stressful to us. But a few months later, the world shut down. And so it was a very galvanizing time for us. We never closed at one office. We continued to see patients in person. We didn't lay off one person. And we ended up coming out of all of that COVID chaos even stronger than we were before. And extremely huge testament to our team at Community Healthcare who really embody the mission that Dr. Alison started 38 years ago, which was to take care of people. So that's where we are now, and we're kind of in a growth phase where we feel like we've kind of really made some great advances in providing high value care to our patients. There's data that shows that patients of community healthcare get higher quality care at a lower cost than the average patient in the nation does. In fact, much better so. And so we're using our model and our care, which is a team-based model, to go to other communities. And you know, that's our name, that's what our mission is. And so our goal is to try to continue to take care of more people. Since I became the CEO, we've opened a new office in Copley, Ohio, another one in Coventry, and we're working on, right now they're doing renovations in North Canton for a third office there. And so we have desire and means to grow, and we're hoping to take care of more people by doing that.
Wow. Yeah, just as you go through that evolution, you know, somebody can envision coming into an organization, being asked to run and to lead it, and be mentors to the staff, as being something that's what some people would love to want to do, but then to have that opportunity, you just spoke of the many different areas that you had to work on yourself, that you learn the medicine and how to treat the patient, but maybe you know, how to speak to them in certain situations when certain test results come back. That's something that might not have been taught. How did you become not only just a leader, but being able to talk to patients, but also your staff, provide that leadership? Because public speaking in general is one of the most feared things. Even doing this, it's like, oh my gosh, cameras, where do I look, and all that. But in that doctor, patient, and team member, that's also a high stress environment, because those are decisions and things that are really impacting people at a human level of how they're going to progress.
And I think there's two parts to that, and I think what you're saying is right on. The thing is, you have to have some skills and some training in order to do some of those tasks. But honestly, what I think is more important than those is the heart you have behind it. And it's sad to see or know of colleagues or hear from patients situations that they've had with doctors outside of community healthcare where there was a lack of empathy, or there was just, you know, and it's our system, the medical system is notoriously broken, and people are just shuttled through. And you know, even people getting diagnoses as serious as cancer are being kind of told and kind of left out with no support. And so I think, you know, you can mess up the mechanics of it if you really do care. And that in med school, at least, we are given tools to talk about bad news to patients, both good and bad. I think what you were mentioning and what I mentioned previously is that having the tools also to have one-on-one discussions with people who are working with you or for you, so with your colleagues, that's a different kind of skill set. And then you mentioned public speaking. As a CEO, I have to do that. I get invited to do things like this. And I will tell you, that's something that you can only get better at through practice and through doing it multiple times. And you guys have done so many of these, like you can see you probably have felt much more comfortable doing it. Like we have a monthly meeting at Community Healthcare with all of our doctors and nurse practitioners and admin. Wow. It's like 80 people in a room. And first year or so that I did that, I was petrified. And now it's getting to the point where I feel a lot more comfortable doing it. I sometimes go up there without much planning because I already kind of know what I want to say, and I don't worry about how I'm going to say it because I'm more comfortable and it comes out better. But again, it's really figuring out, okay, what are my strengths and weaknesses? How can I augment my strengths, but how do I work on the weaknesses that I have to be the best I can be for others? And that's, if you have that heart of being for everyone else, being for patients first, for all of your staff and employees second, and yourself third, you usually aren't going to make any bad mistakes. Mistakes that I've made or that I've seen others make or that my mentor will say that he made was when those priorities or those steps get out of whack. Okay. So that's, I think, the heart of all of it.
Sure. And speaking about the heart, growing up, having community support for yourself with family, supporting you at every twist and turn that came, from sports to school to tests to family life, and you've really taken that to heart. I mean, to really say you've taken how you've been treated and how that support rallied around you at all aspects, and you're not just thinking about yourself, you're thinking about others. And when, as you mentioned, just talking about one specific conversation, you can mess that up. But if your heart, you have that passion and you love what you're doing and you know that you have the tools and resources in place for whatever that news may be, that probably helps you sleep a little bit better at night, knowing that, okay, I'm gonna be delivering some tough news, but I also know that we're going to have the resources available.
And that's really key. I think when you give someone, like if it's a patient getting bad news, not just giving the news, but being able to offer the follow-up support is huge. And that's where, when I mentioned team care earlier at Community Healthcare, where I feel like we've been able to really push the needle forward, because we have a pretty comprehensive, large and dynamic team that we employ for our care. Community healthcare is about half physicians and half nurse practitioners. And I will tell you, the nurse practitioner role, what they've brought to our teams has been an unbelievable asset to our patients. And they have nurse practitioners, by definition, have a nursing background. So they have a lot of experience educating patients, talking with them, counseling with them, spending time with them. And so as they become practitioners who are able to do many of the things that a doctor can do, we can really hone in on that skill set. And what we've done at many places that employ nurse practitioners kind of aren't intentional with it. They just give them the overflow of whatever the doctor can't see. And that might be things that they aren't totally trained or comfortable doing that maybe they haven't seen. And then they have to come to the doctor for help, and it becomes a big, inefficient thing. Whereas what we've learned is the nurse practitioners are amazing at handling chronic conditions and educating patients and spending that extra time. And so we actually task them with that. We give them wellness visits to do. They are doing a lot of preventative care, and a lot of chronically ill people that aren't necessarily in crisis but need help. An uncontrolled diabetic patient, a patient with a lot of mental health issues that needs to sit down and maybe we need to adjust medications. Or someone with heart failure or lung disease that needs to learn more about how to self-manage. They're able to take those 30 and 40-minute appointments to do that, and it frees up us doctors for the patient walking in with chest pain or someone who's really acute. And just getting into those nuts and bolts of how we run our practice, it's been so beneficial to see our patients respond to that, to see that they know that there's not only a doctor but a nurse practitioner, and we employ other nurses that are what we call care managers that can help them navigate the system outside of our office. We actually employ, from a mental health standpoint, licensed social workers who can do behavioral health management in our office. Oh, great. So if someone walks in a mental health crisis that doesn't require the emergency room and isn't life-threatening, we can literally walk them down the hall, have them sit down with a mental health professional, and then work on follow-up. And so being able to put all of that in one space around our patients has been an amazing thing, and we get a lot less of them going out and getting those stories of being swept through the system. And so hopefully we can continue to build on that.
Yeah. As the practice grows and changes, I know there's a lot of dynamics to go in. Is there maybe one or two areas where it's just exploding with demand, interest, where you can probably speak to a bit.
You know what, it's been crazy, but we feel like the amount of new patients coming into our facilities is growing significantly, and it could be that there's good word of mouth about our care, but I think also it's just a demographic thing. We know that 10,000 baby boomers turn 65 every day. And so we continue to get people who need, as they get more medical problems building up as they get older that need care. We love having multiple generational families, so someone in their 30s or 40s is bringing in their babies and their grandparents and everyone. That's kind of the organic growth, and then also as we acquire new offices or open new, we've had over 1,000 new patients in the community healthcare just so far in 2023. And so, my job as one of the leaders is to figure out, okay, I need more physicians. How do we take care of these people? So we keep trying to grow with that.
So how is that aspect with recruiting and retention? I know every industry is a little bit different, but from what you've seen so far in your leadership, is it harder than you thought it would be, easier to find the talent and then retain them?
Yeah, I will tell you, it depends on what physician you're looking at right now, at least from where we are in our market. We have been able to recruit new physicians to the area. We've hired 6 or 7 in the last year, which is a really big win for us. Being in Northeast Ohio, we can't necessarily recruit based on weather or geography. So it says that we're emphasizing the right things because we're trying to give doctors the opportunity to do what they went to medical school to do instead of being caught up in the system. Nurse practitioners, we've been able to recruit and hire and retain. For us, it's been harder, and I think it's just a job market thing with more of the staff members in the office, at the office level. It's been hard to find medical assistants, and so we're looking at ways to become more efficient with the staff that we have, to do more things to retain them, and to just really up our recruiting, to get more involved in medical assisting schools, get people further upstream when they're in their training. We host students and externs at our offices, and almost all of those things, med students, residents, nurse practitioners, MAs, STNAs. We try to, again, as just from our mission of wanting to teach, but also it's a great recruiting tool as well, because those students that like what we do and we like them and work with our culture can then come on. So it is challenging, but and I think it's not only finding enough people to do it, but also finding the right people, and we're always trying to get better at doing that.
Yeah. What keeps you up at night, besides family and illnesses and a child being sick and those types of things? From a business standpoint, you feel like you're in a good spot where you have an idea of what's going to happen or what's coming down the pike. In most instances, obviously, there's going to be curveballs that get thrown in there. Yeah. But I'm just curious I've never asked, I never talked to a physician about it. I wonder from that perspective, because there's so many balls and so many different hats that you're wearing. Yeah,
I think when you look at healthcare in our country, primary care is in a very good position because, first of all, there's a huge shortage. They estimate that there's up to a 30,000 primary care physician shortage right now in the United States, and it's only going to get worse because a lot of those are baby boomer type generation of 60-plus-year-old physicians who are probably going to look at retiring. So we're facing a huge exodus from medicine, and you're seeing on the medical school side less people wanting to do primary care, which is sad because I really do think it's an amazing career path. So that's why not only do the nurse practitioners bring something that we want and that we actively recruit, but sometimes it's out of necessity as well because we don't have enough physicians either. So when you look at the future, primary care is set up very well. Medicare itself is really focusing on primary care as the driver of better value in our country. I think it's well known that even though we are the richest country in the world, we provide some of the least valuable health care, very wasteful. And again, when I mentioned high quality and low cost, we are trying to get that waste out of the system for our patients. We don't want them doing unnecessary testing or seeing 6 different doctors, one for every different body part, when maybe we could handle 4 of those 6 things and keep them in one place. And so we are in a good position that way. However, like you said, there are curveballs, and there's always changes in reimbursement or changes in demographics, or some kind of new notice from Medicare that says there's going to be a totally different payment model. And so, yes, we try to stay very much ahead of those things and try to position ourselves so that we're still going to be here to serve our patients long into the future. Community healthcare itself, with the amazing team that we have, we're in a very good position. But you have to stay on the bicycle and staying ahead of that every day, or else you can fall behind.
Yeah. Thank you for going in such detail. We have a few minutes left at 2 areas, if you're able to touch on. One is your thoughts on. It maybe doesn't have to be on the overdose and the actual method that the overdoses are happening. Even just here in Northeast Ohio, have you seen in your practice any shifts from when you took over to now?
Yeah, I think you're mentioning like opioid crisis and overdoses. I think it is really, really sad to see. It is definitely, when I was in my training 15 years ago, it was a lot different than it is now. It is sad, and I have had patients that overdosed and died. And as a physician, we try the best that we can to try to identify people that need help. Unfortunately, there's such a stigma around it that a lot of patients aren't forthcoming, or just aren't in a place they want to share, or don't think they need to, or don't know they have a problem, or just don't want us to know any of that. And so there's times where we really don't know that something like that's going on with our patients. And we want to be that resource that they can come to for help. Not always able to do that, and I think that's one of the challenges of our system. And I think that's a societal challenge for our government, for our society, for everything from the federal government down to the state and local level. How are we going to handle this? What are the kind of things we need to do as a society to decrease what's going on with this? And there aren't any easy answers, that's for sure.
It's tough to talk about it and think about, and with my own mental health, of everything you just said, of not wanting people to find out, not wanting to believe it, being a man in the relationship, like you can't have feelings, and all those different things. Just myself, and like, I don't need to see somebody, and then it's like at that last minute, like, oh my gosh, like I need to see somebody, but I don't know where to turn. And sometimes there's referrals where it's like, oh, well, we can't see you because you're not dying right now. We'll see you in 2 months. Yeah. And that's where I think your organization and what you're doing is so, it's so key, and it has a niche to be able to, as you mentioned, walk in the door, diagnose something's happening, and be able to see somebody that day, because even if somebody's not in crisis that minute, they might be near that, and just to talk to somebody. And I know for my experience, just when people hear therapy, they're like, oh my gosh, I don't want to go to therapy. I'm like, all you do is just talk about like the last 3 weeks of like what I did. And it just makes me feel better now. Had I known that, 15 years ago, I wouldn't have had to go through some of the things and experience. But to be able to be in a position like you are, to have those resources and do the best you can, I think in today's society, and where, as you were talking about, some physicians, there's in that transaction mentality, like come in, like let's get as many in as we can. Yeah. Here's the news, okay, and then there's that void between getting the news and then, okay, but do I need to see somebody, and I can't get a hold of them, and where you're bringing that all together and truly.
Yeah. And that's one thing we don't want to do, right, is whether it's just you need to see a specialist for something, or yes, you're having a mental health crisis, or you're having a life-threatening disease, we want to be able to walk you through the next steps. And being able to reassure people, like you said, that don't feel like they're allowed or able to express themselves or are able to truly be vulnerable. That's where I feel like primary care has an advantage, because we can build that relationship where someone can say, you know what, I don't trust anyone else to say this, but I can trust you. And we try to get to that point. And again, everybody's different, and some docs get there with patients sooner than others, but that's if you ask a lot of primary care docs and ones that I work with why they do this, I think it's that relationship to get to that point is the key. For someone to actually say, you know, doc, I want to tell you something that's been going on for a long time, and I wasn't able to say it till now. That's kind of the pinnacle of that primary care relationship, because then you can say, okay, that's amazing. I'm so glad you were able to say that to me. First thing you need to hear from me is, I am here for you, I'm not judging you, and I'm here to help. Yeah. Second is, we're going to do this together, and I'm not going to abandon you. If you can make someone feel that and then back it up, that's huge. And again, like you said, you can't do that. You can't say that if you're going to say, call this person, and when you do, they say, we'll see you in 3 months. Okay, were you really there with me? Like, can I really get help? And that's the challenge of the system, because if it's something that we don't provide within our walls, we do have to rely on outside people, and that's where we try our best to find great partners to work with and try to make sure we have a network to help people.
Awesome. So excited to have you with us, to hear your experience, to talk about all the exciting things with you, your organization. For our audience that wants to check out more about you, your organization, job opportunities, where can they find that?
Yeah, our Community Healthcare Incorporated has a very active social media account on Facebook and LinkedIn. So you can apply for job openings on that, on those links there. Our website is chci.com, Community Healthcare Incorporated, and yeah, we love to interact with people, so reach out.
Great. Thank you so much for coming in.
Thanks for having me.
Absolutely.
Yeah, this is great.
Yeah. And again, thank you to our audience for also joining us today on the Voices for Voices TV show and podcast, because we are a TV show as well as the audio version. So I want to let our audience know that in case they've checked us out on audio, but they want to check us out on video and TV, they can do that. And a big thank you to classmate, alumni, fellow alumni, for coming in today, talking in just real plain English about what he's done, the career side of it, as well as the people, and then the medicine side of bringing all those things together, and not being afraid to go out and get training and leadership, and being able to work with the patients, not just delivering news or having a visit, but being able to be with them kind of birth till death, as Brady mentioned. So until next time, I'm Justin Allen Hayes. Hope you have a great day and be a voice for you or somebody in need.